Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our hospital system general director. This is the update from Albany Medical Center on the coronavirus. Today is Incident Command Day 46. We begin with the numbers from the 5 counties. Those numbers have not refreshed yet today, so I'll report the same number as yesterday, 1,688. We've seen those numbers increasing by about 3 or 4% per day. We'll take a look tomorrow and see where they are on Friday. Great news inside here in the medical center. The current cases in-house are 53. That's the lowest number we've had in a while. We had 5 that were discharged. We had 1 that was admitted, and we did not have anybody who died. The breakdown is we have 32 on the floor, we have 21 in the ICU, and we have 12 on the ventilator. 12 on the ventilator, Fred, is great news.
It really is. We probably haven't been that low in 3 weeks.
Yeah. Other great news. We received a call from a CEO named Bobby Kotick. He is the CEO of Activision Blizzard, and he had heard about what we were doing here in the medical center, specifically when it comes to treating patients with convalescent plasma. And so he has directed that a very generous contribution be made to the medical center in support of our program. When we first spoke to him, we had actually used convalescent plasma on 1 patient. And as of today, I think we have an incredible update that we can give.
Yes, we've given the plasma to 24 patients now.
That is great. That is great.
Thank you.
Yeah, so thank you to Bobby Kotick and to Activision Blizzard, and obviously to all the people who are helping us with the convalescent plasma program. We continue to get phone calls, and I know we'll transfuse more in the future as well. I've mentioned in the past that we are an academic medical center. We do clinical care, we do research, and we do education. And Fred, you were the chair of medicine here, and Journal Club is something that you're familiar with.
Yes, Dennis. So we would have Journal Club once a month, maybe twice a month in different areas within the department. And what we would do is we'd pick an article or 2 out of the literature. Someone would be the primary reviewer and would come and present it. Everyone would be expected to read it, and then we would discuss it and see what we learned from that.
And it's obviously very difficult these days for us to get into rooms and have a journal club, but they are still happening remotely, virtually. Yesterday, there was a very special journal club led by Dr. Andy Coates. He's one of our hospitalists here, and it was also organized with the help of 15 medical students. The medical students very much part of our academic mission here. And it was all about COVID-19. It talked about epidemiology, disparities, pathophysiology, and treatment. And I believe there was as many as 50 people who participated in that journal club.
Yes, a very, very large number. There's a lot of literature being published on COVID, and actually, literally every day there's new stuff coming out. There's an article that hopefully we'll review in the next journal club that I read today about the rate of rise of infections out of a county in England. And it's interesting from this perspective, Dennis. At first, the positives is going up exponentially, so very rapid rate of rise. And then they close the schools and institute social distancing, and the rate of rise slows, just as you would expect, but now documented in over 1,000 people in that county.
All right. So it speaks to all the efforts that social distancing is helping for, and it also reminds us that this, as an academic medical center, the literature is an important part of us.
It helps us make decisions, helps us do what we need to do.
Speaking of virtual meetings, we were contacted by the University at Albany about a virtual town hall with some physicians from Wuhan, China, who wanted to be able to share their experience with us so we could learn better about how to deal with the situation. And I think Fred's going to give us an update on that.
So, as Dennis said, they reached out through the University at Albany. There are 3 either emergency department physicians or critical care physicians, or both in the case of 1. And they just want to share their experiences, kind of help us through what's going on here in the United States. So we'll get a group not only of physicians here at the medical center together, but we'll share this with all of the physicians in the community that we've been talking to on the phone every day, sharing our results.
And we thank the University at Albany for reaching out to us, and we certainly look forward to learning that. We often give you an update here on our own numbers. Today at the governor's press conference, he began to talk about some of the numbers from antibody testing in the state. You'll recall we spoke about this earlier in the week. There were some pop-up locations. There was 2 in this area where they were doing essentially a random sampling of people to see about antibodies. And I have some numbers here that were reported at the governor's press conference today, and then we're going to talk about them. So allow me to read this here. There was 3,000 people sampled all across the state. and they were measuring whether or not there was the presence of antibodies in that person for coronavirus, which would suggest that they had been exposed to it in the past.
Right.
In New York City, the percentage that were positive was 14%. Excuse me, in the state it was 14%. In New York City it was 21%, Long Island 17%, Westchester 12%, and up here in upstate New York 3.6%. So when you take the statewide percentage of 14%, that means that they can estimate that there's approximately 2.7 million people in the state who would be positive for antibodies. When you take the total number of people that have died so far, which is 15,500, that gives you a mortality rate of approximately 0.5%. 0.5%, so 1 in 200. Fred, what do you think about that data?
So the number that we were thinking for mortality was more like 3.5%, because we were looking at the number of deaths versus the number of known cases, and those are symptomatic cases. Obviously, a lot of the people that were positive in this antibody test had asymptomatic infections. So instead of 3.5%, if the mortality rate is 0.5%, that's a lot better.
It is a lot better. How do you think that compares to the flu?
Well, the flu's mortality rate's about 0.1%. So 5 times greater than the flu, which is not good, but not, 3.5%, which is obviously much, much higher than 0.1%.
So we caution, as always, that this data is the first round of data. As we get a lot more antibody testing, we'll see if these numbers hold up, and we'll share that information with you as we go forward. Finally, today, I think we want to do a shout out to a very important department in the hospital.
And you can tell we're wearing anesthesia jackets today. So when this all first started, the anesthesiologists, who can be on the front lines of patients with the infection, created what they called a COVID intubation team. So when a COVID patient gets really sick and needs to go on a respirator, you have to intubate them, put a tube down into their lungs. And that's generally done by our anesthesiologists. So they created a special team in the hospital 24/7 to do that on patients with COVID. And some nights, unfortunately, they were very busy intubating 4, 5, 6 patients. As of today, that team's been disbanded because we don't have that same level of illness within the hospital. So shout out to anesthesiology, tremendous job. Thank you very much.
I share in that. That includes the anesthesiology techs, the CRNAs, and the anesthesiology attendings. Kevin Roberts was the chair, and we welcome Dr. Stephanie Jones, who's the new chair of the department as well. So thank you to all that they are doing. We'll be back again tomorrow. It will be Friday. We'll end the week on some good news, as always. Once again, we ask that you please take care of yourself, take care of each other, and we'll see you tomorrow.